Hello everybody. The thought that my surroundings are clean so I cannot get tuberculosis is completely wrong. So I start my video with this opening statement. You have to understand, India is a global village. You can have all sort of environment surrounding you. So you living in a city can get TB, somebody living in a rural area can get TB. Any environment is prone to get tuberculosis. It's a major problem which we have been dealing in India for last almost more than 5 to 7 decades. This year, 24th March is being observed as the World TB Day. The theme of this year's World TB Day is to invest to end tuberculosis and save lives. The main idea of this theme is that we all have to partner together, whether it is the government agencies, private agencies, doctors, paramedical staff, community level, health workers, everybody, and we all have to invest towards ending this pandemic from our country. Now, we have to understand few points which everybody in the community should know. Any cough of more than 2-week duration is significant. If you are losing weight, which you do not understand why, if you think you're not feeling hungry, that means you have got loss of appetite. All these things may be an early indicator of you suffering from a problem called tuberculosis. Do not think that if you're not getting cough, if you're not getting phlegm from your throat, you do not have TB. No. TB can affect every part of your body. It can affect your brain, it can affect your bones, it can affect your skin. You can have TB of any part. So never get misled by the thought that TB affects only the lungs. TB is a problem which is more commonly found in population when there are very closely knit, where there's hardly any social distancing. Now we all know about this term social distancing after COVID. Somebody is suffering from TB, they cough, you can get TB from the person. Then diabetes, we are a diabetes capital of the world. So uncontrolled sugar levels may make you prone for tuberculosis. Young kids come to us, they have problems of dieting because of the peer pressure. Dieting makes you again prone for getting tuberculosis because of your depressed immunity. People suffering from HIV, people on long-term steroids, cancer survivors, all these patients are huge chances of getting tuberculosis. So it's my appeal to all of you that be careful of yourself, be careful of your relatives and friends, be careful what happens in your surroundings, and always see your doctor at the earliest. I get patients at very late stage when things are very difficult to treat. Come early, diagnose early, so that once we start you on the treatment, this disease is completely curable. Never have anything in mind that once you got tuberculosis, your life is finished. Nothing of that sort. One last statement about a bigger problem within the span of tuberculosis is the multi-drug resistant tuberculosis, where even the normal TB medicines do not help. So do not allow your disease to become multi-drug resistant. Always see a specialist in tuberculosis so that you get the right treatment. So best of luck to all of you. Have a good healthy life, have good nutrition, and make sure that you are all well informed and keep informing one and all in the society. Thank you so much.